Hello, welcome to Genetic Vitology Functional Wellness. My name is Dr. Diana Haley Rezak, and I am a certified functional medicine practitioner. I'm here today to give you a little bit of an introduction into functional medicine and my genetic vitology program. First, let me start off with the name of my company, Genetic Vitology. It comes from vitology, which is the study of vitality through genetics and their expression. So first, I'm going to give you a little bit of history about me. This is one of my favorite things I love to do is aerial yoga. And the reason that this is so personal to me is 20 years ago, I could barely walk across a room on a cane. I had chronic headaches and dizziness and hip pain and neck pain, shoulder dislocations. I just had widespread global pain. I had Hashimoto's, thyroiditis, diabetes, a lot of extra weight gain, just a variety of symptoms. And I went from specialist to specialist everywhere trying to find answers. And most of the answers were more medications, more surgeries, and a lot of not getting any real answers. So this was really frustrating to me. And this is what set me out on my functional medicine journey. So I originally had started out as an exercise physiologist and got my doctorate degree in physical therapy, where I'd learned a lot about vestibular rehab and orthopedic rehab that helped me quite a bit. And through both my quest for solving my own issues, as well as wanting to serve the patients that I was working with, I kept seeking more certifications and training and became board certified in both orthopedics and neurology. I became fellowship trained in orthopedic manual physical therapy, and was significantly better, but still continued to have a lot of health issues. And at some point in there, I found a functional medicine practitioner who really was the first person who said, even though you're eating what seemingly is a healthy variety of foods, maybe if you eliminate certain foods that could be aggravating or inflammatory and change some lifestyle things around, you wouldn't have to take the medications and you can actually get better, which was a huge relief to me, being diagnosed with Meniere's disease at the age of 19 and losing half my vestibular system and hearing. That was the first time somebody had ever told me I could change my outcome. And that set me on that trajectory where I started studying a lot more about lifestyle factors and how that can change your health and getting away from pharmaceuticals. So through this process, I became a certified functional medicine practitioner, and I'm also a FMFT Academy certified practitioner. So that's a little bit about where I started. So first, talking about functional medicine, there's a lot of definitions, and some people are a little bit more familiar with functional medicine than others. First of all, functional medicine is a systems biology-based approach. It focuses on identifying and addressing the root cause of disease. So each symptom or differential diagnosis may be one of many contributing to an individual's illness. Then there's the definition of a functional medicine practitioner, and that's the person who, with a medical degree, who looks at the contributing factors. So, kind of a medical detective to get to that underlying root cause and can advise that person on specific lifestyle changes, such as exercise, nutrition, sleep, etc., based on their genetics and biological functioning at the cellular level. Then we have a functional medicine health coach, and that's someone who coaches a person through the changes that are recommended by the practitioner, including mindset, values, beliefs, level of readiness to change, implementing strategies, that kind of thing. So, Dr. Di, me, my genetic vitology approach is the combination of the medical practitioner as well as the health and wellness coach all in one program. So, how does the functional medicine approach work? I like the tree example here. So, in more traditional Western medicine, we look at the branches of this tree, where if you have GI dysfunction, you're going to go to a gastroenterologist. If you have diabetes, you might go to an endocrinologist. If you have heart symptoms, you might go to a cardiologist. So you're going to go to a different specialist for every symptom or every diagnosis. In functional medicine, rather than looking at the individual branches of the tree, we look all the way down to the root cause. And we look at things if there's an imbalance in the immune function, inflammation, digestion, is there oxidative stress, problems with detoxification, How are the hormones and neurotransmitters functioning? And it's a physiological process of communication, cell regeneration, elimination of waste, and protection or defense and transport of cellular material. So genetics are what you're born with, but doesn't mean that they're a death sentence, if you will, or that you will necessarily have that diagnosis, because we look at what's called epigenetics. And epigenetics is how those genes are expressed with lifestyle factors and that individual's unique attitudes, beliefs, and experiences. So you see in this tree model, we're looking all the way down to how the person is doing from their genetics, their epigenetics, mind, body, spirit, everything along that, and what physiological processes and clinical imbalances are contributing to multiple symptoms. For example, you could have a yeast in the gut microbiome that could be causing allergies, as well as gum issues, tongue, nails, in addition to GI dysfunction. And it could also be causing things like sleep apnea. So instead of saying, okay, we're going to give you a treatment for each diagnosis, we look at what commonality is between all these diagnoses across multiple disciplines. The other example I really like is the iceberg. And this is kind of another visualization where in traditional Western medicine, we tend to look at the tip of the iceberg, which is things like anxiety, depression, PTSD, autism, diabetes, arthritis, whatever. It's whatever you diagnosis code you're given and go to a medical professional for. When in reality, a lot of these things can be very interrelated by things like toxins and mitochondrial dysfunction, the digestive microbiome, immune imbalances, structural imbalances. All these could be related under the surface, but we're only looking at the tip of the surface in traditional medicine. This is the illness wellness continuum. And in traditional medicine, we tend to look at this neutral point, which just means I don't have any symptoms or diagnosable disease. So all the way on the far left, you look at severe disease, premature death, or near death, and in between all levels of poor health. So in traditional medicine, they look at the treatment paradigm between where you're barely alive to getting you to that neutral point of no symptoms. The problem with that is it doesn't take you to the full wellness spectrum, which is on the right side of optimal health, where everything is functioning well at the cellular level, your mind, your body, your spirit, everything is great. The problem with only going to that neutral point is all it takes is one illness. It could be a virus, it could be an injury, anything like that to knock you down into severe dysfunction and needing a lot of therapies and rehab, as well as medical treatment. Versus when you're all the way at the wellness side to optimal health, you're much more resilient and your body can repair and defend and do its job. So I like this quote from Andy Dufresne of the Shawshank Redemption movie. I guess it comes down to a simple choice, really. Get busy living or get busy dying. And I choose to get busy living. So why we need to think about changing our mindset on healthcare in the United States. For one, we are getting increasingly less healthy and more disease with each generation. And it's anticipated that the generation of children today will be the first to have a shorter lifespan than their parents. That's pretty profound. We've had a 60% increase in obesity in the past 40 years. That's important because a lot of other disease processes tend to be linked to obesity, especially because carrying excess fat also means that we are carrying excess toxins into those cells that are being stored. And that can wreak havoc on many other cellular processes in the body. We've had an 85% increase in autoimmune conditions in the past 30 years. 60% of adults in the United States have one chronic health condition, 40% have two or more. In the United States, our healthcare ranks last amongst the wealthy countries. Our cost of health care is number one for all countries across the world and number 37 in quality. We have the poorest health of any developed country, and only 20% of our healthcare dollars actually go to health. So how do we get this way? Well, there's a variety of factors, but just to touch on a few of them, we're overfed and undernourished. Our food sources have been compromised by growth hormones, pesticides, toxins. It's in our food, our air, our soil, our water. The standard American diet has extra large portions, the supersize me. Quick convenience foods. We're a faster paced society. People are working more. They're busier. They want something they can run through a drive through and get. And a lot of these quick convenience foods are heavily laden with excess refined sugar, salts, fat, and very low in nutrient dense foods. So you're not getting a lot of the essential vitamins and minerals that you would from eating a wide variety of fresh veggies and fruits and other foods that are not processed. We're overstressed and we have less good activity. So there's a lot more responsibilities on individuals and the family unit. We seem to have less family or community support. There's increased expectations from work and home. Many times, both parents are working and raising children, and children are more active, going to more games and extracurricular activities. Everybody's just very busy. Um, and we just don't ever turn off. We have constant input from our electronics, internet, and technology. We have it on our smartphones and our tablets and our laptops. So there's more room to take work home, and we tend to work later in the evening and not go to sleep with the sunset like we did before. So we spend a lot more time with technology doing more sedentary activities because we have the ability to shop from our laptop, have everything appear at our door. We don't necessarily have to get out and forage for food and build things like we used to. And then there's our traditional Western medicine health system. We tend to focus more on symptom amelioration medicine versus health. And that means trying to make the symptom go away, which in my opinion is like putting a band-aid or a piece of duct tape over your check engine light. So instead of actually looking for what's causing the problem, we tend to use pharmaceuticals, injections, and surgeries because they're recommended first and covered by health insurance. And things that really contribute to health, like specific nutrition for that person or specific activity or lifestyle modification, is not covered by health insurance. So it tends to go to the wayside and only for people who really find this somewhere in their life that this is a valuable um, way of addressing their health. And then lastly, the changes in genetic expression is passed to future generations. So we can change our DNA through our RNA each generation. So all of these factors that are coming in, they're changing the expression of the gene. So when that person has offspring, that offspring has the modified gene. And so the health issues can be passed from one generation to another. And this also goes for our food. I always say we are what our food eats. And so, to the point of using growth hormones and um, chemicals to try and enhance our food, it's very different than it was, 30 or 50 years ago, where this top left image of a chicken shows an image of a chicken in the 1950s versus an image today. They're definitely larger, they've been injected with hormones, and we're kind of the same way, where we have just taken on more toxic burdens and our population is larger and bigger each generation. So back to the iceberg example. So Titanic actually sank because the conditions were too good. And people don't always talk about this fact, but it was a flat, calm, dark, moonless night and really rare conditions. So there's no moon, no wind, no waves, no swell. There was nothing around the iceberg to know that it was there. And in some ways, our population is getting the same way. We have very calorie rich diets that are nutrient poor. We have convenience foods. We have delivery at our fingertips to have everything delivered in a store, a fast food restaurant. We have climate controlled environments, so we don't have to work very hard to bring our body temperature up or down. We have technology, which allows us to be very sedentary. We work on symptom amelioration. If I have a pain, I take medication for it, an Advil, Tylenol, Percocet, whatever. Um, and again, the sedentary lifestyle is all part of this whole package. So we are making some progress. I don't want to be all gloom and doom. I really am optimistic for our future. and starting to recognize that people, for example, if they have a certain diagnosis like diabetes or heart disease, these are modifiable risk factors that you can change. And we started to have recommendations like the food pyramid, which we have since changed to the food plate, but also recognizing that we need to move and we need to breathe and eat well and live well. So this is great, except these are general guidelines for a diagnosis, not a person. Doesn't take into account that one person with diabetes may have a different underlying root cause than another person based on their genetics, their hereditary factors, ethnicity, a lot of other things, and as well as lifestyle. And so it's a general recommendation based on a diagnosis or a disease that has nothing to do with the individual. So in general, these guidelines tend to work for about 40, maybe 50% of the population. So again, why these general plans as well as general food plans do not work. It's kind of like shopping for jeans. There's really no average. And there's tons of food plans out there. Like you hear about keto and AIP and paleo and vegan, and it's very confusing. Which diet plan should I follow or which food plan? And that's because there isn't a right one for every person, because each person with hypothyroidism is going to have very different presentations and a different combination of symptoms and underlying factors. So there is no one size fits all or even most. Each of us is very unique in, like I say, our curves and proportions, or we're not all one specific size, and that goes to our genes. So much like our cellular structure, we all have our specific needs. And functional medicine is kind of like having a tailor-made, making your genes for you with your health and unique personality in mind. So another problem with the general guidelines for the average population, do you want to be common, which means that something occurs often or is frequently prevalent? And if you look at the United States population today, and even emerging around the rest of the world, when we were discussing earlier that 60% of Americans have one chronic disease, 40% have two, and many have more. We have an overall very disabled population where we cater to disability due to immobility and disease. And so this is hard. Would you really want to be common in this population? My answer is no. Normal means that nothing is out of the ordinary and everything is working well. So unfortunately, all these guidelines are generally designed to benefit a significant number of people with that specific illness, and they don't consider the specific genetics or lifestyle factors of the individual. And likewise, most medical research aims to prove that a medicine or procedure improves a person's symptoms with a specific illness, and they don't examine healthy lifestyle factors or changing the course of the disease progression. They're only looking at, can you mask that symptom? Each of us has a unique genetic code for our nutritional needs, our activity, sleep, exercise, and we all have a unique predisposition to different diseases. So research and guidelines aim to do the best for the most people along this, not for the individual. So it has more to do with population epidemiology and the population welfare than the individual, where functional medicine focuses entirely on the individual. So how does the program work? First, we construct a timeline. So we gather a very detailed history on everything that is known about the person, their genetics, their family history, any exposures to toxins, metals, any environmental stuff, carpets, pets, that kind of stuff, life events, any illnesses, disease, pharmaceuticals they've taken, surgeries. And then we examine, what have you already learned works for you and what doesn't with nutrition, exercise, lifestyle factors. And we constructed a timeline, which is really useful in identifying critical times in the process of illness wellness, because we can oftentimes see this person really had nothing going along here, and then all of a sudden this event happened, and then within a couple years they had this one and this one and this one. And we actually, through functional medicine, can look at somebody being on the trajectory to a disease even decades before they're diagnosed in traditional medicine. So next we put it all together in what we call the matrix. And the matrix looks at things like the structural integrity of like how is your gut, how is your skin, communication of your brain and your cells, looks at defense and repair, like are you having issues with sinuses or breathing, any of that kind of stuff. And we look at all those things that we were talking about before from the bottom of the iceberg or the root cause and say, how are these all related? And we kind of look at our antecedents, which are things that happened before we were born, like uh, when we were in utero or that came from our family genetics. And then we look at triggering events that could be an intervention or a life event. And then we also look at anything that's what we call a mediator or perpetrator, like what else accelerated this process. So let me go a little bit deeper into genetic testing. And this isn't the same as what you might have heard about, like 23andMe. This is medical genetic testing. And we can look at so many things from this aspect. It shows genetically what we are predisposed to, things like obesity, diabetes, cancer, cognitive decline, inflammation, and what level of risk we carry for these, as well as the exciting part, what nutritional, lifestyle, and exercise factors will enhance or suppress the expression of these genes. That's called epigenetics. We talked about a little bit before. So basically, it's telling us, okay, if you have this gene, these foods and these activities are going to help this gene not express what you don't want it to. So we can see whether the person needs high, moderate, or low exercise, what types of fat they process best, and how, if they have any intolerances to like lactose, carbohydrates, caffeine, alcohol, and whether their muscle and joint recovery is like, help them determine their best course of nutrition plan and activity. So keep in mind that only 8% and potentially only 2% of, according to our new research, of our inherited genes contribute to our health. The rest is how we treat these genes with lifestyle factors. So we always say that genetics loads the gun, but our lifestyle factors pull the trigger. So just because you have a strong family history of a certain disease does not mean you're necessarily going to have it. If you have a strong family history and you repeat the same lifestyle factors of the family members that have it, you are more likely to have that same illness or diagnosis. So by knowing your specific nutritional and activity needs, we can enhance the best expression of the genes you have, again, called epigenetics. So all of this, we compare, this is what you're genetically predisposed to, what your history has been, where you've been along this trajectory. And then we look at current labs and specialized testing is needed. So first we look at any blood tests or tests you've had done from other medical providers, putting this all into a combination medical deductive package of how maybe that low vitamin D could be contributing to some mood alterations, anxiety, depression, but also could be disrupting some hormones or contributing to some high cholesterol. So that's just an example of how these might all go together. So we also look at some more specialized testing, like how is your gut or GI functioning? Is there any bacteria in there? How much good bacteria do you have? Do you have any commensal or bad bacteria? Is there any yeast overgrowth or any parasites, tapeworms, those kind of things that are impacting the cellular regeneration? We look at how's your hormone functioning. Do you have imbalances that contribute to mood, like depression, anxiety, energy loss, cortisol spikes, reproductive function? And then, are there any issues with inflammation, detoxification, and oxidative stress, as well as cellular repair? So that's pretty much how well does your body eliminate the toxins in the environment that you're taking in. And it's estimated in the United States that the average infant today is born with over 200 toxins in their umbilical cord. So we're already starting out at high toxin load, and it becomes greater need for us to detoxify from just this bombardment of chemicals in our environment. And we also look at, were there any other exposures? Could be mold, toxins, Lyme disease, anything else that maybe took away from the nutrient absorption. So the good foods that you're taking in, those nutrients are being extracted into these other living organisms inside your body and being eaten up instead of being used for cellular repair. And then how is your current lifestyle supporting or impairing your health? And that goes mind, body, spirit, looking at all facets of that. So it's basically real solutions tailored for you. So we work on a specific plan just for you, specific nutritional activity and supplements just for you, eliminating any of the bad bacteria or yeast, removing any toxins, reducing inflammation, reducing stress, restoring hormone balance, providing any antioxidant support you needed, and looking at cellular mitochondrial health, which mitochondria are the energy powerhouses of your cell, and they're in every cell of your body. So mitochondria is very important for energy and repair. So we find solutions based on your level of readiness and ability to change with your current life demands and personal situation. It's a truly customized health plan. So to kind of compare and contrast how functional medicine works with traditional medicine. Let's take this case example of a person who starts noticing symptoms like fatigue, weight gain, joint and muscle pain, headaches, maybe some indigestion, constipation, diarrhea, brain fog, or mood regulation problems. They might also have some hair loss, brittle nails, a little bit of gum disease, chronic sinus congestion, and likely there were some other early signs in childhood or early adult, like allergies, migraines, maybe endometriosis or fertility issues. In the traditional Western medicine model, we run lab tests, and generally, especially in the beginning stages, everything comes back fine. It's normal. There's nothing wrong with you. And they say you're just fine. Perhaps they'll prescribe a medication for the symptoms or tell you to eat less and exercise more and come back in a year. The problem is this process can go on literally for years or decades, where each year you don't feel better and likely worsening with symptoms, and they keep telling you you're fine, but you don't feel fine. So then eventually, when something shows up on a blood test or an image as an abnormal finding, the provider pays attention and says, oh, here's your medical diagnosis. I'm going to refer you to so and so, or I'm going to give you this treatment. And a lot of times that makes us feel better because we're like, finally, after all these years of feeling like I'm losing my mind and my body and all my function, I have a diagnosis. So then a lot of times you'll get a prescription or medication, maybe an injection or surgery to make your symptoms feel better. Problem is, these methods don't really cure the underlying disease. Again, they just ameliorate the symptoms and cover them up. So over time, new symptoms and diseases may develop. So that's how we can end up with multiple chronic illnesses from the same root cause. Let's take the same person in the functional medicine approach. So you have all the same symptoms, but the practitioner in this scenario looks at the symptoms the person is experiencing at life from through their life history from birth to the present moment, including genetics and examples of what is working well for them and what's not from a cellular level to detect impairments in repair and regeneration. These can usually, like I said, be detected years or decades before you have an actual medical diagnosis. And then through more extensive testing and examination of how the person is functioning, both with interviewing the patient and figuring out how what's working, what's not, what activities of life are being impaired, we make specific recommendations for nutrition, exercise, and lifestyle modification, as well as any supplements that are needed to get the goal of natural sources with few to no pharmaceuticals. This is all designed to work with that person's genetics, what they respond to, and it is a combination of testing, but also teaching the person to pay attention to what's going on in their body, like looking at their stool output or their urine output and knowing what they eat or do and how that affects their body. So this person will work with a practitioner and improve the way their cells are repairing. Then they are better able to stop the disease progression and usually reversing or eliminating it. They look at all the organs and systems of the body and treat the underlying impairments, the root or the iceberg, in cellular regeneration and repair. So the person generally will feel better with functional medicine than they did before their onset of symptoms. Because, like I said, most people have progression over years or decades, and it's happened so subtly and slowly that once we remove all that, they have this renewed vitality and energy they haven't experienced for quite some time. And then that brings you to my Genetic Vitology 16-week Jumpstart program. So this is a 16-week comprehensive program that includes testing for genetics and stool and a lot of the tests to figure out what's going on, as well as the whole lifestyle timeline matrix, putting this all together. So that's all in the comprehensive review of the medical and life event timeline. We review any laboratory and medical tests that you've already had done. We include those food sensitivity, stool, and genetic testing. And then we may order additional tests as necessary, depending on what symptoms or problems are found in the initial discovery. Then we develop a very personalized program with nutrition, activity, supplements for your specific needs. There's a collaboration with an entire team of functional medicine practitioners and wellness coaching, which is important to help you succeed wherever you are on this journey. Oftentimes, people may even go to a functional medicine provider where they will say, okay, you should follow this food plan, work on these exercises, and take these supplements, and I'll see you in 6 months or a year. But the problem with that is a lot of times people don't know where to start. And it's hard to know, okay, how do I substitute this food out? Or how can I make a modification here? Or I'm in a lot of pain. I can't move that much. And that's where the wellness coaching comes in, where it's a step-by-step process of helping you through the journey. We have a weekly Q&A session, group support, um, program content on nutrition, activity, toxins, lifestyle modification, tips for success. There's an interactive portal for regular chat with me as your provider. You have journaling, feedback, coordination of care, all through the secure HIPAA compliant portal. And then monthly one on one individual check ins via telehealth. So the great thing is it's a customized program for you, your pace, done in the comfort of your home. And then I coordinate with other medical providers as needed to share information and try and get to the root cause of everything and heal you to the best person that you can be. So, who is my program for? I'm looking for people who are decisive. They're ready to make a change now. They're committed to working on their health and wellness. They're coachable, receptive to new ways of doing things, and they're resourceful, able to be creative with solutions. This isn't a do it for you program, it's a do it with you program. So I'm not looking for people who have all the answers. I'm looking for people who know they need to make a change and this is the right path for them and they want an ally in that process. So let today be the day that you love yourself enough to no longer just dream of a better life. Let it be the day you can act upon it. So thank you for watching my introduction to functional medicine and my program. Kind of think of me as your medical detective and health and wellness coach all in one. I'm helping people to feel better, live better, and be better. So if you're ready to start this journey with me and find out more information, please contact me for a free consultation and we can discuss your future health and how my program might work for you. Thank you. Have a great day.